Good afternoon, and we'd like to welcome you to the webinar on Friday, July 24th. This webinar is being sponsored by the being sponsored by the Healthy Flint Research Coordinating Center, and we are experiencing a little bit of technical difficulties right now, but we are so happy that you joined us today. We have a very, very exciting webinar for you today, so please stay tuned. We want to just remind you, for those of you that are joining us for the first time, that the Healthy Flint Research Coordinating Center is a multi-institutional partnership led by a strong community core, along with Michigan State University, the University of Michigan Flint, the University of Michigan Ann Arbor campus as well. And we are also streaming live today. So for those of you that are joining us by live streaming, we'd like to welcome you all today to this webinar. Some exciting information for you today. We talked to you last week about the Flint pipe replacement program, and we've got some updates for you today on that. I want to also remind you that we have been talking about the focus of this has been the coronavirus for the last 19 weeks. We've talked about many of the issues that have faced us as a community, but we also recognize that this is a global pandemic, and we're excited that other representatives from across the United States have found our work valuable, so they have joined us each week as well. Your involvement and your input has been so critical to the success of the webinars. So I want to remind you that if you look at the bottom of your screen, for those of you who have joined us in the webinar, to please put questions in the chat today, or excuse me, in the Q&A. Put them in the Q&A today. We do have wonderful panelists who are able to respond to your questions today. Just to give you an idea of who some of our panelists are, we do have Kirk Smith, who is the CEO of the Greater Flint Health Coalition, Dr. Susan Wolfer, who is on staff as a clinician in the pediatric unit of the University of Michigan Ann Arbor, but she is also a co-director of the Healthy Flint Research Coordinating Center. In addition, we have Nicole Smith Anderson, who is a representative of the Greater Flint Health Coalition. If you have questions about some of their programming, the CHAPS program, or the Flint Registry, you can put those questions in the queue, and they're here to answer those questions for you. We're delighted to have with us Jim Melanowski from the Genesee Health Plan, who has provided for us insights and information about programs and services that are available to you through the health plan. Dr. Lawrence Reynolds, who is the health advisor for the mayor of the city of Flint. He is also on today. We're going to hear from Jim Melanowski, Dr. Lawrence Reynolds shortly. We also have Suzanne Cooper, who's been with us every week, who will be able to give us some updates from the Genesee County Health Department about the things that are happening, some updates on testing as well. Clarence Pierce, who is from Hamilton, the CEO of Hamilton Community Health Network, will be here today answering questions for you about the process of Hamilton Community Network as it relates to testing, which we know is so important. We'll also hear an update from Gary Jones out of the Office of the Governor, specifically focused on keeping us in the Flint community aware of what's going on. Delighted to say again today, we have Dr. Tupper, who is a physician in the emergency department at Hurley Medical Center. He is on the line with us today. And if you have questions about what's going on at Hurley Medical Center, please put that question in the queue. He'll be happy to answer those questions for you. And we also have with us today Jared Webb, who was with us last week, talking about the pipe replacement program from the University of Michigan and Blue Conduit. We'll have more information for you today. So we appreciate our panelists and thank you for joining us each week to respond to the questions and provide insights and information for us in the Flint community. We want to move now and again invite you to join us if you are on listening by YouTube and you have questions. You can go to the info@hfrcc.org to put your questions in, or you can give us a call at 810-835-2130 and your questions will be responded to. We'll make sure that we can put those questions in the conversation for you today. So we want to follow up. Dr. Reynolds is here with us today, and we want to do a little bit of follow-up. Dr. Reynolds, welcome today. We had some questions last week, and I think we've got those questions answered today. But we want to just give you a space to kind of bring us up to speed. We talked a little bit about water restoration. We talked a bit about the pipe replacement program. Just as a quick reminder, can you tell our listeners how important this pipe replacement is for the city of Flint?
All right. There used to be a rapper who said, I have 99 problems and this ain't one. Well, we don't need another problem. And lead is a problem. And there's lead in the soil and dust. There's lead paint chips. There's lead in certain products we buy. There's lead in the plumbing fixtures we buy. And historically, we have had lead service lines. In other words, that connection from the water main in the street to our house also has lead. And we have been trying to replace those lead service lines over the last 4 years. We have had some delays and setbacks, but it is continuing. Uh, First, you have to determine if there's a lead service line, and that has been determined by various techniques. Uh, but if you have never tested the water in your house, you need to test that water. And you can get a water test kit from City Hall. Okay. And then if you have signed up for your lead service line replacement, you should just check in and find out where you are on the waiting list. And sometimes that changes according to what major reconstruction projects are happening in your neighborhood, just like what was going on DuPont Street, where because the streets were already torn up, the Department of Public Works took advantage of that opportunity to replace lead service lines there at that time. But unfortunately, there have been people who have refused to have their lead service lines replaced. And they really need to reconsider. And I know over the last week we had some confusion about the telephone number, what number to call in order to get your lead service line information, to get and also to get reconnected. Uh, it is, and the number is before you as we speak right now. Okay, if you dial that number, 810-232-2558, you will get a voicemail. Uh, you leave your information and they will call you back. And I did the same to check yesterday. And I called, and it's in the offices of ROWE, one of the contractors. And I did get a call back within 2 hours. So you must leave your name and your telephone number to get a call back. And that's for reconnection. Okay. Now for lead service line replacement, they are proceeding. And I think sometime in the future, it would be a good idea for us to have someone from the Department of Public Works to go into that in detail, because
Yes,
I can't tell you that schedule.
right. Well, thank you, Dr. Reynolds. I appreciate you bringing us up to speed on that because we did commit that we would follow up on that question regarding the number. We also have Jared Webb, who was a member of the conduit, the Michigan University of Michigan and Blue Conduit team that talked to us about the map. And I just want to invite Jared, if you want to take a couple minutes here and give us a little update. I know you all did some work on this as well last week. So can you give us some update based upon the input that you received from the participants?
Yeah, I think our main update is that we have, sorry everybody, 1 second. I, I have a child in the background here, sorry, no. um, so um, the main update is with the phone number. So we have an update to the website that's going to reflect the new phone numbers, and we'll be pushing that up later today. And like Dr. Reynolds says, we have also confirmed and called after a wild goose chase this week, called various numbers. We have confirmed that 810-232-2558 is the phone number to call. That you can leave a message there, and you will you'll hear back, and you can get your self on the schedule using that phone number. Otherwise, we appreciated all the feedback and questions we got last week, and we've tried to respond to each person individually that's reached out to us. If anyone else has questions about the pipe map, feel free to ask a question right now on the Q&A, and we'll get to it, or you can email us using the contact information on the pipe map website.
Thank you, Jared. And again, let me appreciate you and Blue Conduit team for responding and being open to the questions. So I just cannot emphasize enough to our community participants, whether you're an organizational leader, resident, community health worker, outreach worker, whatever your role or responsibility is, we appreciate you sharing, because it does help us to make a difference. And thank you for that quick response. The other thing that came up from some of the questions in our queue and from participants, even throughout the week, we continue to get questions, was around the testing sites. And we know that we have Clarence Pierce here with us today, who is the CEO of the Hamilton Community Health Network. And we've been promoting that people can go over to Hamilton Community Health Network and get tested. And when they got there, they met with some things that we didn't quite clarify. So we've asked Clarence Pierce to come on today and give us some clarity on the process in getting testing at Hamilton Community Health Network. So Clarence, please give us those insights.
Well, thank you once again, Yvonne. I'm happy to be with you this morning. And, I know a lot of people are getting tested now. We have seen our numbers increase significantly over the last month, and going up by the day. The COVID-19 testing at Hamilton Community Health Network has to be scheduled. And the process is to call Hamilton's COVID hotline at 810-406-4019 to schedule a COVID-19 test. Hamilton's call center will then connect you with a Hamilton provider. Hamilton's provider will hold a brief telehealth visit to review your symptoms and place an order for the COVID test to be performed. A test will then be scheduled at a clinic site or at our drive-through location. Now, we have 2 drive-through locations, one on the north end at our North Point location, and one on the south end at our Burton facility. And let me emphasize that anyone can receive a COVID-19 test at Hamilton. It doesn't matter whether you're insured, uninsured, patient or not a patient. But the callers who are not Hamilton patients are processed just the same as a Hamilton patient. Basically ensure we have the patient's information, enabling us to follow up with the patient on results and close the loop on the testing visit. So we get that information, and once we get the results, we can contact the patient, give them the results of the test. And if by chance it happens to be positive, we want to make sure that they understand what it is they should be doing in terms of quarantining themselves away from friends and family. Now, you probably have heard getting the test results back, unfortunately right now, is a little bit of a problem. All of our tests goes through our Quest lab. Quest is backed up significantly. And in our conversations with them, they have indicated that it can take anywhere from 10 to 15, and we had one case that took 19 days to get back the results of the test. This is a problem because we would like to be able to get people's results back as soon as possible. And there is really no consistency right now. If we suspect someone is positive, and we let them know that we think we have a positive case, we are getting those back within 3 to 4 days. But Otherwise, it can take up to 10 days, and we need to get those tests back much faster than that. So we're working with Quest and trying to identify perhaps another lab that we can work with and trying to get the test results back much faster. But we welcome anyone. And again, I say it doesn't matter whether you're insured, you're uninsured, whether you're a patient or a non-patient. Hamilton will test you and make sure that you get a test as expeditiously as we can. Now, from our standpoint, we can get the test done. We have multiple locations. We test at all our sites. And like I said, we also have the 2 mobile sites, but you can get tests right in our individual facilities as well. But we are having some difficulty getting those results back, and we're working on that. And even working on getting an additional lab to help with that process. So I want to just emphasize again that our locations are safe. The clinics are very well kept. We have our hand sanitizer. The staff have their PPE. We provide masks to patients who come in for whatever reason, and we take every precaution to make sure that all the patients and staff are safe when they enter the clinic. We have a number of signs that gives you some instructions about what to do when you get into the clinic. And so we're doing everything we can to ensure the safety of the patients and our staff. And I'm sure that you see people dressed in the mask and sometimes the face shields and some other type of equipment, gowns and so forth. Don't be alarmed. It's just one of those precautions we have to take to make sure that the staff is protected, and it also protects you. One of the things about wearing a mask is not only are you protecting yourself, but you're protecting the people that you come in contact with. And so it's one of those things that we have to do to make sure that we're all protected. So we welcome anyone, Yvonne, to come in, whether it be at the clinic or whether it be at our drive-through. Come in, get tested, and we'll get it all taken care of for you.
Thank you, Clarence. I appreciate it and that you give us this additional details, because we do have commercials out and we have been saying generally people can go and get tested. And so when they come and they say, well, it was something that was in the process that you didn't tell us about, I think it's critically important for us to ensure that we get this information out as well, so that people are not discouraged and they know that there's a process. It may take time. Just one quick thing. You talked about telehealth. For those who are not familiar with telehealth, can you just give us a brief understanding of what that is, what that actually happens?
Yes, Yvonne, actually the telehealth is the actual call when the operator transfers the caller over to the provider. The provider will do what we call the telehealth visit. That's when they extract a little more information in terms of what's going on with the patient. Mm-hmm. And that's why we think it's important for the patient to talk with the provider, because there may be some other things going on outside of just the symptoms involved with the COVID-19. There may be some high blood pressure things going on. There may be some other possible things going on that the provider can actually diagnose in that phone conversation, and the patient may need to follow up for some additional care. So that's why we feel it's important for them to do that telehealth visit, talk to the provider. Provider will get a much better understanding of what's going on, and then can instruct the patient and direct them on what they need to do going forward, as well as give an order for the test.
Yeah, so basically they're having a doctor's visit by phone.
Exactly.
Great. So Clarence, this is great, because it leads us to the next conversation with Suzanne Cooper at the Genesee County Health Department. In addition, I think she'll be able to respond to some of the questions that are coming up in the queue, particularly as it relates to pediatric testing, because At this point, we have had some issues and concerns about pediatric testing. So we thank you for letting us know how it's going to work at Hamilton. And you've got 2 sites. And now Suzanne's going to give us some more updates and let us know there are some additional sites coming up for our community members. So Suzanne, would you please give us that update?
Sure. So let's start with the testing numbers, which we report to everyone each week. We report to our website at 2 p.m. every day the latest statistics for COVID-19 in our community. For those of you who may not know, it's www.gchd.us. You can go there every day at 2 p.m. and see the updates that I'll be providing. Starting next week, you'll see some additional data that will be added to our website that we'll be posting once a week. Things like the reports that I've been providing to you, the percentage increase or decrease in the number of cases that have been in the past week, the number of tests that have been conducted, and some additional information that kind of gives you an idea of what the trends and the data are. So the data are wonderful and very helpful, but having those trends, I think, and having them interpreted for all of our residents is another element that helps them decide what their level of risk is and recognizing what's happening in our community as we move forward with COVID-19, fully well knowing that it's not going to be going away anytime soon. Hopefully it'll provide a little bit more information for everyone. So as of yesterday, we reported 2,549 positive COVID-19 test results. And a reminder for everyone that early in the pandemic, we were not able to test everyone that we would have liked to have tested for COVID-19. And as a result, we may not have reflected every positive COVID-19 individual in our community. So these are numbers of people who actually got tested, and recognize that we have had a 40% asymptomatic positive rate. What does that mean? That means that of the people who were tested positive for COVID-19, many of them did not have symptoms. So that's important for us to talk about. You hear Dr. Reynolds say it's not a one and done. It isn't. It's something that we need to be mindful of moving forward. We had 269 deaths that were reported since the beginning of the pandemic. And this week we've seen a 27% increase in the number of cases over what we saw last week. And I've been reporting to you for the last 4 weeks that we've been seeing this gradual increase in cases. So we're very mindful and paying very close attention to those trends. The increased number of positive cases have been in the 20 to 49-year-old age groups. So keeping in mind that that's another key message that we want to keep reminding everyone to wear your mask, social distance, wash your hands, use hand sanitizers, all the preventive measures that we're going to continue to share with all of you as we move forward. We had 1,051 reported test results since last week. Now we're working on trying to get a little more accurate information about the actual number of tests that are conducted each week. This is reflective of the number of test result reports that we got back. Now you've just heard Clarence say that they're seeing a delay in the test results. As you heard me say last week, we are observing the same thing, that we are seeing that delay and that we've been averaging 2 to 14 days for test results. Clarence has talked about some experiences where it's taken a little bit longer. That is a trend that we're monitoring very carefully and being mindful about. I also mentioned to you last week that some of our care facilities, urgent cares, et cetera, we're having difficulty accessing some of the kits that are required to collect a sample to start with. So we are working actively with all of those organizations trying to make sure they have adequate supply and monitoring that. We report back to our colleagues at the state regularly, so they're aware of what we're experiencing in Genesee County. So wanted to make sure that you were aware of that. I want to talk a little bit about the test locations that are available. So you've heard from Clarence about Hamilton Community Health Network. We have the 2 Rite Aid locations, one in Swartz Creek and one on Clio Road in Flint. Those are still open and available. Again, Swartz Creek is available all week, 9 to 5, and Flint is available 10 a.m. to 8 p.m. Monday through Friday, and 10 a.m. to 5 p.m. on the weekends. They also have a process that you have to go through their website to make an appointment, and we recognize some of the challenges for folks that do not have access to the internet or a website. That's why we work so hard to make sure there's community testing where that's not a requirement. Same is true of the Walmart Supercenter, which is on Corona Road. The appointments that are made for Quest, which operates Monday, Wednesday, and Friday from 7 a.m. to 9 a.m., are made via the Quest website. We work to make sure that we are also offering testing opportunities in the community that do not require a doctor's appointment, that do not require any kind of pre-registration via a website or via email, etc., because we want to make sure someone can just come and get tested. We don't want anyone to have barriers in order to be tested. We will share with you that last week when we were doing the testing at Word of Life, we were not aware that the National Guard was not going to be doing pediatric testing. So we are on site today and tomorrow from 9 a.m. to 1 p.m. at Macedonia Baptist Church, and we are conducting testing. The National Guard is testing the adults, but staff members from Genesee County Health Department, including our own Kim Van Sleg, who is a nurse practitioner, are doing testing for pediatric patients. So both adults and children can be tested at Macedonia today and tomorrow, again, 9 a.m. to 1 p.m. There is no doctor's note or appointment needed. Just show up and get tested. I do want to make sure that you know that the registration form is available on the Health Department website. So if you do have access to a website, you can print it off and fill it out before you actually arrive on site. That should not be a barrier to anyone because the forms are available on location as well, and you'll be guided through the process on how to do that. We work in collaboration with our city, county, and state partners, trying to make sure we secure testing locations in Genesee County, and our state colleagues have been able to secure a vendor to provide community testing. Hopefully those sites will be up and running by September, and we'll provide you more information when they're confirmed and their hours are concerned. But those locations, again, will be operated by a vendor. There will be no doctor's note required. There will be no appointment required. They're all going to be accessible to everyone that may have a disability. We are working on all of those arrangements now. And the great news is that the contract for this vendor is for 6 months. So we know we're going to have them available in our community for a longer period of time. And we're really excited to be able to provide you more details as they become available on those 3 locations that will be coming up. And if there are any other questions, don't hesitate to reach out. But I encourage you to go to our website again, www.gchd.us, to look for information. If there's something that your community needs specifically and you don't see it on our website, don't hesitate to reach out and let us know, and we are happy to tailor materials specifically for various groups. And to remind you, like Hamilton, the health department's clinics at our Burton location are up and running. So WIC's available, breastfeeding supports are available. We have our sexually transmitted infection testing still happening. Immunizations are happening. We're going to talk a little bit more about that in a minute. And also family planning. We are doing things by appointment. You will get a temperature check. We will ask you a few questions about whether or not you've been exposed to someone who had COVID-19, but those services are all available to everyone. I encourage you to please come and get what you need. And if you need other services at our McCree South building, feel free to call ahead to make arrangements for anything else that you might need from the health department.
Thank you, Suzanne. I appreciate you bringing forward those other areas that the health department is still providing services for, like WIC and the immunizations. This is something I know is very important to the hospitals, and Dr. Tupper is still on. I'd like to just give him a minute to chime in here, because I think this is really critically important to the hospitals, that patients who need urgent emergency care do still come to the hospital. Dr. Tupper.
Yes, Yvonne, thank you. Again, we've talked about this over the last several weeks, but again, a point again to emphasize is that if you feel you need to seek medical care related to a COVID-19 like illness, or really any other illness, be that concerning symptoms like a stroke or heart attack, chest pain, shortness of breath, very important not to delay the seeking of care. In the hospital setting, we're taking all the precautions we can to minimize any transmission. Right now, we continue to see a low volume of COVID-19 patients, but there has, as you can see in the numbers, since the reopening, been a small uptick in the number of positive cases in the community in Michigan. In the hospital setting, we similarly are facing challenges with regards to this testing supply chain. In that some of the labs we have been sending tests to, and typically getting results in 1 to 2 days, are now delayed as long as a week, and that's just related to the national surge in increased testing demand across the country, not being able to keep up with the supply of testing capacity, because many of these labs, like Quest and the other labs, are national labs where they're testing not only our patients, but Florida, Texas, Arizona, California, that is in the midst of significant crisis and surges right now. So we do have some limited capability for testing in the hospital, but that's mostly for patients requiring admissions and symptomatic evaluations. But even that is being challenged by getting all the testing kits we need, because again, there is just a national demand everywhere for tests that we're continuing to try to meet. So we've had to address some issues with prioritization of testing once again, but it's all related to our supply and trying to meet the needs of the community.
Thank you, Dr. Tupper. And a couple of quick questions for you, because you're in the emergency department. One participant wants to know, is there a quarantine area, particularly in the emergency department, for those who are expected to have COVID? And is there a way to rule out COVID like immediately?
Yeah, so we will cohort those patients in that, one, everyone's in a mask, and two, patients suspected to have COVID or COVID symptoms are, the effort is to essentially put those patients in a room and isolate them immediately. So yes, to that point, the ability to rule out COVID immediately, there's no immediate test. All the tests take time; they have to be run in a lab. But there are some testing capabilities that can be done in our institution within hours. So not necessarily immediate, but within hours, we are able to evaluate for COVID. So in some cases, it's several hours. It sort of depends on the timing of the tests, but able to rule it out as good as the test can be. within hours. There are some more rapid testing modalities available that provide results within 15 and 30 minutes, and we're currently exploring those as options. But the trade-off from a more rapid test is you do lose a little bit of accuracy. And so it's always a balance with getting a rapid result and the most accurate result. So we're exploring how to use the more rapid testing methodologies that provide results within 30 minutes. But that's probably about the fastest testing capabilities available right now is 15, 30-minute tests.
Thank you, Dr. Tupper. And you're popular today. I have one more quick question for you. One participant wants to know, is the COVID test included in all pre-admissions testing for those who are scheduled for procedures?
So currently they're being evaluated for surgeries and for admissions. Currently, there are a number of factors that are looked at to determine whether they need to have a COVID test. Anyone with any symptoms concerning for COVID is being evaluated for COVID prior to any surgeries or admissions. For other patients that are asymptomatic for other reasons, right now we're currently asking a set of other screening questions, such as any exposures, relevant factors like coming from a group living environment where potentially might have been exposed. Have you been isolated or out and about and potentially exposed, to evaluate for the need for testing?
Thank you so much, Dr. Tupper. Again, Dr. Tupper, for those that are on the webinar and that may be the webinar from outside of our community, Dr. Tupper is a emergency physician at our Hurley Medical Center. And we do hope the information that's being shared will help you even in your communities as it's helping us here locally in Flint. Thank you again, Dr. Tupper. We have had from our participants some questions as we do our pop-up evaluation at the end of each of our webinars. And one of the issues that came forward was about immunizations. So we have three of our wonderful panelists today that are going to address this, and that is Dr. Lawrence Reynolds, Suzanne Kupel, and Dr. Susan Wolford. We want to talk this next few minutes about immunizations. And while we're getting to that, I don't want to miss this. There is a question in the queue. Quickly, Clarence, can you give us the number again for Hamilton Community Health Network?
Yes, Yvonne, that number is area code 810-406-419, 4019, 406-4019.
Right, so I hope that those of you that are listening, if you need to get in that process, please give them a call. Dr. Reynolds, this is again a near and dear to you. You're telling us all the time these one and dones don't get it. Yes. And immunizations is really, really critical. Can I give you another question that's in the queue that I think is important, that kind of fits in as we're talking about even the screening? But there's a question about mental health opportunities for screening. And is this being included in substance abuse testing sites as well? So I don't know how you can weave that into the conversation, but there's some mental health concerns here as well. But let's talk about immunizations.
All right, so you want me to talk about immunizations now?
Yes.
And is it correct that I am talking about adult immunizations?
Yes, sir.
All right. And I think I'm eminently qualified because I once was a child that got immunizations. I once was an adult, and now they call me a senior getting immunizations. And they are very important for all of us throughout our lifespan for two reasons. In the senior age group, we grandparents and we parents do not want to infect our children and our families and the young people we come in contact with preventable diseases. And if you will look, there's a long list on what you see on the screen. I would guess there's easily about 13 different conditions for which we have immunizations. And I'll summarize. There's hepatitis A, and you remember we had a hepatitis A outbreak in the state of Michigan during our lead crisis that lasted for about 2 years. And so there are immunizations for that. And those immunizations are available for children, but they're also available for adults and seniors. There's hepatitis B. When I say hepatitis, I'm talking about an infection of the liver. And these are things for which you don't want to get an infection if you can prevent it. There's another immunization called human papilloma virus, HPV. Now, we really recommend that our children get it, and I will let my colleague, Dr. Walford, go into detail on that. But these are things, if you don't get your immunization at the proper time, you can infect others. And then there's meningitis, meningococcal vaccine. There's a pneumococcal vaccine, which deals with infections of the lung, the brain, and the blood. And then there's shingles, and shingles comes from the same virus that causes chickenpox, and it gets reactivated. And I'll share personal history. You do not want to get shingles. I was lucky. It was across my abdomen, and so it felt like someone was scraping a knife across my insides for a couple of days. But imagine if you get that on your face, across your eye, around your rectum, around your genitals, you will, it is agony. And if you have active lesions, you can also infect someone around you who has not had chickenpox. So there's also, and it comes up every year, the influenza vaccine. Now, there is a nasal spray, but it's not for people over 50. But there is an enhanced influenza vaccine for people our age, 50 and over, and 65 and over, that you can get that will give you further protection. Now, everybody says, if I get the flu vaccine, I'll get the flu. No, you don't. You may have a slightly elevated temp. You may have some soreness on your arm, but you may have also already had some previous viral infection that has manifested itself, become symptomatic during the time or after the time you got your immunization. But believe me, you do not want to risk getting influenza, especially, nor pneumonia uh, during this time, actually during any time. So we have a pneumonia vaccine that has 13 components in it for younger people. And now we have an improved 23 component vaccine. And I'm not saying you get 23 shots. What I'm saying is it's all in one, and it will reduce your chances of getting pneumonia. So if you have diabetes, lung disease, kidney disease, and if you're just alive, you really should get these things to prevent these infections so that you can help take care of your little ones. So I think I've said enough right now. Oh, and many people say, well, I don't know who my doctor is. And we have ways you can find out who your doctor is. If you have an insurance card, call that number on your insurance card. If you haven't ever seen your insurance card, why don't you call our Community Health Access Program at the Greater Flint Health Coalition, 810-953-2427. 953-2427, or call the Genesee Health Plan. They can connect you. And I've said a lot, and I haven't even covered a fifth of what I'd like to talk about, but you can find excellent information on our Genesee County Health Department website, and I'll let Suzanne handle that, the CDC, and the Greater Flint Health Coalition website, or call your doctor. I'm done.
Thank you, Dr. Enos. I do want to emphasize that this slide that we're showing right now is available, I believe, on the CDC website. I know it's a bit small, but we just wanted to give you the image of it so that you can go out there and find this slide. And we are looking toward finding opportunities to get copies of this to make available throughout the community. So if you want to go on that website, the CDC website does have this available for you. Suzanne?
Yes, Yvonne, we'll put it on the health department's website in the COVID section specifically, so that it makes it easier for people to find. I wanted to piggyback on what Dr. Reynolds said about protecting our young ones and how important it is for anyone that is going to be around an infant to get a pertussis vaccination. We have to recognize that children get immunizations on their right. And I know Dr. Wolford's going to talk a little bit about that, but we provide that protective bubble in which that child is cared for. So it's truly important that we're not only thinking about childhood immunizations, but as adults, what we need to be immunized for so we protect those children who are most vulnerable. I'll also remind everyone that our immunization clinic at the Genesee County Health Department is open. We are doing things by appointment. But remember, we're social distancing. We're doing things by appointment. I'm encouraging everyone that needs to get up to date on immunizations to do that now. Make the appointment. Don't wait till the mad rush before school starts, depending upon what happens there. But also recognizing that you want to be able to get up to date on all your immunizations so that you're ready for a flu shot. And some immunizations, you might want to wait a little bit before you get the flu shot. So I'll pass that back to Dr. Reynolds if you want to make any comment about that and talk a little bit about shingles being 2 vaccinations, et cetera.
Yes, and Dr. Reynolds, I'm glad you threw that back to him, Suzanne, because we also have a question in the queue about the best time to get the flu shot, and can a person get the flu shot and the pneumonia shot at the same time? So Dr. Reynolds, help us out.
Yes, you can. And you may have heard me talk about in the earlier presentations, if you're behind in your boosters and other immunizations, regardless of your age, why don't you get them now? Because the flu vaccine does not come out until usually the end of August, early September. And why is that? The labs and the scientists look at the influenza or the flu worldwide, and generally they look at what's going on in the southern hemisphere, and that gives them an idea of what flu they need to get prepared for us in the winter. So it comes out late August and early September. So that's when you can get your influenza vaccine.
This is Suzanne. I want to again remind everyone that we are strongly encouraging everyone to get a flu vaccination because we are going to have 2 respiratory illnesses. We will have both COVID-19 and influenza. We have various types of pneumonia. It's really important to make sure that you're doing everything you can, not only in maintaining your health, but making sure that you have all the appropriate vaccinations that help prevent you from having 2 respiratory illnesses at the same time. So we know that vaccine will be available at the end of August. The health department has it. Most of the pharmacies have access to it. You can check with your doctor's office, but it's really important that everyone get the flu shot this year. And it is an amazing opportunity for you to get up to date on everything else that can help protect you from having a respiratory illness at the same time with COVID-19. We will be promoting immunizations in our community. We know that we're going to have access to more vaccine this year, so there is no reason why we won't be able to provide a flu shot to anyone who needs it.
Thank you, Suzanne. And that was the adult segment. There was a little bit of overlap with the children because we talked about pertussis. And so, Dr. Wolford, can you talk a little bit more about the children's vaccinations and then explain what pertussis is? Because adults actually are kind of the carriers and can cause children to get pertussis. Is that correct?
Thank you so much, Yvonne. Can you hear me?
Yes. Yes, please.
Wonderful. And if I can be allowed to share my screen, you're completely right that pertussis is something that even when you get vaccinated against it, it protects you for a while, but then that wanes off. So adults really need to make sure they're up to date on that so that they can protect the children that they come in contact with who may not yet have been vaccinated. So it's saying that somebody else is sharing. There we go, thank you. So now I'm going to be able to share my screen. I believe, is that sharing now? Nope.
Not yet, Dr. Wolford.
Not yet. Let's try this. Let me try this way. I think I can get it here.
I think, there we go. We got you now.
There we go. Okay. So I want to first make mention of the fact that many of the illnesses that we used to see, we don't see as often anymore because of the success of vaccination. So this is just a picture that shows some children convalescing from polio. As you notice, it has severely affected their mobility. It was a significant cause of paralysis and death. And before vaccines, we saw many of these horrible illnesses, but vaccines in children have been so successful that we don't see those things now. So what vaccines are we talking about? Well, here is a slide from the CDC, and you can see this at the CDC website, that shows a number of the vaccines that children should get between birth and age 4 to 6 years of age. So you'll see that they can start off very early on with hepatitis B vaccination. And then at 2 months, they can start being vaccinated against rotavirus and diphtheria, tetanus, and pertussis, which we've been talking about, and Haemophilus influenza, and the causes of meningitis, and again, polio. But it's important to note that prior to 2 months of age, they could not get those vaccines. So it is incumbent upon adults to be vaccinated so that we can protect those children prior to the time when they can get vaccinated. As you see, as I think many of us are aware, there are many vaccines. They have to be repeated. They get it at 2 months, and then at 4 months, and then at 6 months. And so we have to be sure that children are getting all of these doses so that they are optimally protected from these illnesses. Now, I know many appointments were delayed during the height of the pandemic or the beginning stages of the pandemic, but now there's no reason for delay. All the doctor's offices are able to give them, and you can make arrangements to maybe even go in early in the day so you'll be less likely to come in contact with people who may be ill with any infectious disease. But now I also want to mention that not only do you have to think about children when they are less than 4, but also at 11 years of age and 16 years of age, they should get more shots. So in particular, I want to mention at these ages, they would get shots against meningitis. And so we want to be sure that they're being taken in for these vaccines and that they don't miss their vaccinations. Also, I think Dr. Lawrence mentioned that there is the HPV vaccine. You get that at age 11, and there are 2 doses that you get of those. But just to emphasize that meningitis, which would be dreadful to get at any time, particularly we don't want people getting these illnesses now on top of or along with all of the problems with COVID. But we have to remember that it's possible to get kids in to get these shots. They're all available right now. So remember to take them in at age 11, age 16, and for those infant shots as well.
Dr. Wolford, may I ask, there's a question in the queue. Is there a schedule for pertussis for adults? When should adults get the pertussis shot in order to be able to protect children?
So I'm going to leave that for Dr. Reynolds to answer.
Okay.
But
Okay.
there is. You do have to get it repeated.
Every 10 years.
All
So
right.
if you, we used to say if you step on a nail, you need to go get a pertussis shot. So some of us may have gotten it in the emergency room, and it's a combined vaccine. It's for tetanus, diphtheria, and pertussis. So every 10 years. So if
Thank
you
you, Doc.
can't recall, go get it.
Thank you, Dr. Reynolds. I remember they used to say lockjaw when we were younger. You want to make sure you that was one of the symptoms of that tetanus. While you're here,
Tetanus.
Dr.
And
Reynolds,
particular,
I'm sorry.
so I just want to mention, in particular, if you are pregnant or you're living at home with somebody who's pregnant, you should be sure that you get your DTP, your tetanus, and your pertussis vaccine.
This is Suzanne at the health department. I again want to say how important that is. We had an infant death in a 1-month-old from pertussis, and it was a grandparent that exposed the child. We don't want to have any deaths in infants. That's the best way to protect them. And just remind everyone, please don't wait till the last minute to make an appointment for your child's immunizations. Recognize that we're social distancing, we're doing appointments, that we won't be able to see as many people in the same time span because of COVID-19. So plan ahead and plan for getting those immunizations now.
So there's one more question. Thank you, Suzanne, on this pertussis. Is there another more common name that we often hear for pertussis? Is that
Whooping
also?
cough.
Oh, yes,
Thank you.
whooping cough.
Yeah. I think people might relate to the whooping cough a little bit more. And it's an unusual kind of cough that people get. And it's just much more difficult for children, infants particularly, to overcome that. And so often die of asphyxiation, if I'm understanding that correctly, because they cannot get their breath. So adults, we have a responsibility to help protect our children. I am so excited today that there are so many questions. As we prepare, we've got about 3 minutes left. We want to ask you, those of you who have not put your questions in the queue, please do so. I noticed today that some of you have been using our chat feature that was open today. So we thank you for that, and look in there and get those responses to questions. Gary, I'm going to ask you to hold on and come back and be with us next week. Gary Jones always has tremendous updates from the state. I don't know if you have one, Gary, that you know we need to get right quick today.
Only thing I can say is just try to get out and enjoy this weather.
Get out and enjoy the weather. All right, thank you. Just remind you though, Gary
With
Jones
social distancing, I should add that Dr. Reynolds will kill me.
And your mask.
And your mask.
Gary, I just want to appreciate you as being an incredible resource for our community of all the things that are coming out of the governor's office. Your number is here. We want to encourage our webinar participants. Please call him at 517-282-3193 or email him at jonesg9@michigan.gov. Get on his mailing list and you will be up to date on all of the things that come out of the governor's office. So Gary, we thank you so much for being with us every week. Dr. Deborah Furholden, we want to give you this last minute or so to just give us that really, really important emphasis on the things that we need to be mindful of.
Well, you end on time and I see 12:59. So I'm going to pick 3 things and tell people: wash your hands, mask up, get tested. We say these same things every week. And because we got our physicians on, continue with your primary and preventive care. 3 other opportunities I don't want you to miss. Number 1, do your census, 10 minutes for 10 years worth of funding. Please honor these protocols. Please stay safe. And if you are not registered to vote, register to vote. If you are registered, register or encourage somebody in your family, friends, or your community to vote. Because now more than ever, our vote count, our voices count. Thank you, Yvonne.
Thank you, Dr. Deborah. And again, much appreciation to each one of our panelists today. And for those of you that tuned in today, your involvement has made this a rich, rich webinar today. You can continue to subscribe to encourage people to subscribe to our YouTube channel, Healthy Flint. so that we can continue to bring this information to you. Send your questions in to us, and it is extremely important that you complete the pop-up post-webinar survey. It helps us every week bring the information that's credible and important to you. So again, let me thank you for being with us today, and we certainly want to see you and hear from you next week. Have a wonderful day.